Welcome to the deep dive. Today, we're really digging into something fundamental, something that shapes, well, everything from how you feel day to day to massive global health plans. We're talking about health.
Yeah, it sounds simple, doesn't it?
Yeah.
Like you just know if you're healthy or not.
Right.
But the material we're looking at today, specifically these excerpts on health and holistic health, from a community medicine angle,
Yeah.
it shows there's way more to it. It's actually evolved a lot.
Uh-huh.
And the text frames it as like a core tool for figuring out community health problems and planning what to do about them.
Hmm. So it's bigger than just one person's feeling.
Exactly. So we're going deeper than just not being sick. That's the mission today. We'll unpack the famous definition, see how thinking's changed, look at all the different dimensions or parts of health,
Mm.
and then see how this newer, bigger picture of the holistic view actually gets used out there in policy and community health, all based on what this source tells us.
Okay, so where do we start?
Yeah.
Probably with the definition most people run into first, right? The WHO one from 1948. Yep, you hear it all the time. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So, what does the source say was so good about this back then?
Well, for 1948, it was pretty radical. The text really highlights that. It is a huge jump from just the biomedical idea, basically. If a doctor didn't say you were sick, you were healthy.
Right.
This WHO definition brought in mental and social well-being as equally important. That was big. And it talked about positive health, not just not being ill, but actually being able to, function, participate in life.
Okay, so it definitely broadened things out a lot. But the source doesn't just praise it, does it? It has some criticisms, too.
Oh, definitely. The critique in the text is, well, pretty standard now, but important. That word complete, that's the big one.
Complete, yeah.
Defining health as complete well-being. I mean, that sets the bar incredibly high, maybe impossibly high. It kind of suggests this perfect static state, which, isn't really how life works, especially with chronic conditions becoming more common. People live well with conditions.
That makes sense. Life fluctuates.
Yeah.
Health fluctuates. Complete sounds very final.
Exactly. And the source also notes that, okay, it added mental and social, but it missed some other key things we now think are vital, like spiritual health, emotional health, environmental factors. And like you said, it doesn't really capture that dynamic feeling. Health isn't just a switch you flip on or off.
Yeah.
It changes.
It's interesting, though, that even with those flaws, the source positions it as the essential starting block. Really shows how our understanding has, built on that foundation.
Absolutely. And the source maps out that evolution really clearly. So if biomedical was just no disease, what was the next step?
The text talks about the ecological concept. This idea saw health more as a balance, an equilibrium between a person and their environment.
Oh.
So getting sick wasn't just something wrong inside you. It was seen as a kind of maladaptation, like you weren't adjusting well to your surroundings.
And that's huge, because that thinking, according to the source, paved the way for preventive medicine. If the environment matters, well, we can change the environment or change how we interact with it to stop people getting sick in the first place.
Makes sense. Then after that, the source brings in the psychosocial concept. This is where things get even broader, right? Pulling in mental, social, but also economic, political, even spiritual dimensions explicitly.
Right. And this is where the text puts a lot of weight on those bigger societal things, stuff like poverty, inequality, how our lifestyles impact us, not just germs causing problems.
And that leads us to the modern idea, which the source calls the holistic concept. It sounds like this one tries to bring everything together.
Pretty much. It's described as synthesizing the earlier views, seeing health as everything working together in harmony, body, mind, spirit, and the environment. It's all connected.
You can sort of see that thinking pop up more now, can't you? In public health and things like AYUSH systems in India that the source mentions, even in global ideas like One Health connecting human, animal, environmental health, it feels fuller.
It definitely does.
Right.
Which leads perfectly into the next point the source really drills down on. If health is this complex thing, it must have multiple facets or dimensions.
Yeah, the text makes that super clear, drawn on standard public health thinking. It's not just physical. We've mentioned physical, mental, and social from the WHO definition. But what else does the source say counts?
Well, beyond those big three, it lists several more. Spiritual health gets a mention having a sense of purpose, values, inner peace. The text actually notes this was added later to the classic list, which is interesting.
Okay, what else?
Emotional health, which the source kind of separates slightly from mental, focusing more on managing feelings, emotional stability,
Right.
and importantly, vocational health, finding satisfaction, purpose in your work or your main activities.
I wouldn't have immediately thought of that one, but yeah, it makes
Yeah.
sense.
And connecting back, environmental health, having a safe, clean place to live, super important.
It's revealing that the source highlights knowing these other dimensions beyond the obvious physical, mental, social is key. Makes you appreciate just how many things feed into feeling truly well.
And that understanding, knowing all these dimensions exist, is really the bedrock for the whole holistic health idea itself. The source presents it as this all-encompassing framework.
Yeah, seeing how the physical, mental, emotional, spiritual, environmental pieces all rely on each other. What does the text say are the practical bits of holistic health?
It breaks it down nicely. For physical, it's the obvious things.
Hmm.
Nutrition, exercise, hygiene, immunizations. For mental, it's about resilience, coping with stress, not just the absence of illness.
So,
Spiritual is that sense of purpose, inner harmony. Social involves support networks, feeling included, social justice even. Environmental covers basics like clean air and water, safe housing.
wow.
And then there's economic vocational things like job security, fair pay, having a decent work-life balance.
That really paints a complete picture, doesn't it? A full 360 view. And the source ties this into the wellness model, shifting the focus from just fixing problems to actively aiming for the best possible health, for flourishing.
Exactly. It's proactive, not just reactive.
So, okay, we have this big, multi-layered understanding of health. How does that actually play out? How does it get used in, say, community medicine or public health work?
According to the source, it's absolutely fundamental for doing what's called community diagnosis.
Okay, what's that?
It means figuring out the health situation of a whole community. It's not enough just to count cases of flu. A holistic viewpoint helps you see the real problems by looking at those underlying determinants, social issues, environmental risks, economic pressures.
So understanding why health is good or bad in that community.
Precisely. And only then can you figure out the best places to intervene, to set priorities.
Makes sense. And what about promoting health?
Well, it's central there, too. The source points to the Ottawa Charter, which is like a foundational document for health promotion from 1986. It lists 5 main ways to promote health.
Which are?
Things like building healthy public policies, creating supportive environments, strengthening community action, helping people develop personal skills, and changing health services to be more preventive.
And the source says these actions are basically holistic in nature.
Yes, because they target the whole person and the whole community. They recognize that health isn't just made in hospitals. It's made where people live, work, and play. It's about addressing all those dimensions we talked about.
And this isn't just academic theory, right? The source gives real-world examples of this thinking in actual policies.
It does. It mentions Ayushman Bharat in India, specifically the health and wellness centers. The idea there is comprehensive primary care. So, yeah, treating illness, but also mental health support, screening for chronic diseases, wellness activities. It's a broader scope.
Moving beyond just the urgent stuff.
Exactly. The source also flags India's National Health Policy, 2017, for pushing prevention and promotion, integrating traditional systems like Airway UH, and focusing on overall well-being.
And globally.
Globally, it points to the UN Sustainable Development Goals, especially SDG 3. Ensure healthy lives and promote well-being for all at all ages. The source describes this goal itself as holistic because it covers everything from maternal health to mental health to environmental factors and social issues.
So the policy world is catching up, or at least reflecting this broader view. What about how we measure health? Do our metrics capture this complexity?
Some are trying to. The source mentions a few key indicators that reflect a more holistic perspective, like the Human Development Index, the HDI.
Right, that includes education and income, not just how long people live.
Exactly. It gives a broader picture of human flourishing. And then there's daily disability-adjusted life years.
Okay, what does that measure?
It tries to capture the total burden of disease, not just deaths, but also the impact of living with illness or disability. How many years of healthy life are lost? It accounts for impact across different dimensions.
So using things like HDI and daily helps us see beyond just, did someone die, to how well are people living, which fits that holistic idea.
Precisely. It gives a richer understanding.
Now, another really important idea the source brings up, which kind of pushes back against that static, complete well-being idea, is that health is, well, it's constantly changing. It's dynamic.
Absolutely crucial point. It exists on a continuum. Think of a spectrum with optimal wellness at one end and, well, death at the other.
And most of us are somewhere in the middle.
Exactly. And where we are on that line shifts all the time
Yeah.
based on, everything: stress, diet, environment, luck. It's not a fixed state.
This also connects to that iceberg phenomenon idea mentioned in the text, right?
Yes, that's a great illustration.
Yeah.
What we usually see, the clinical disease that gets diagnosed and treated, that's just the tip of the iceberg showing above the water. But underneath the surface, there's this huge hidden mass people with early stages of disease, no symptoms yet, risk factors building up, those underlying social or environmental issues driving the problems.
So a holistic approach tries to see below the waterline.
That's the goal in public health, yes. To detect things earlier, address the root causes, and prevent the tip from getting so big or even appearing at all.
So for you listening, especially if you're studying or working in health, the source basically says understanding all this, the definitions, the evolution, the dimensions, the holistic view isn't just background info.
No, it's foundational.
Yeah.
It's described as the core philosophy you need. Being able to, say, critique the WHO definition intelligently, or list dimensions beyond just physical, mental, social, or grasp that health is dynamic, that's presented as really essential knowledge.
Okay, so let's boil it down. If we pull together the absolute key takeaways from this source material, what are they?
Okay, first, that WHO definition. Hugely important starting point, major step forward, but we also need to understand its limits and how thinking has moved on. It's an evolving idea.
Got it. Second.
Health is definitely multidimensional. Physical, mental, social, spiritual, emotional, environmental, vocational. You can't just focus on one piece and expect to understand the whole picture.
Right. Third takeaway.
Holistic health is that modern, integrated view. It's about seeing the connections between body, mind, society, spirit, and environment. They all influence each other.
Okay. Fourth.
This holistic model isn't just theory. It's increasingly showing up in actual public health programs and policies around the world.
Good to know. And fifth.
And finally, if you want to effectively promote health or figure out what's going on in a community, that community diagnosis thing, you absolutely need that whole person, whole community, holistic perspective.
So wrapping up this deep dive, the big message from this source seems pretty clear. Health is so much more than just not being sick. Our understanding has really expanded.
Yeah, it's moved to this much richer, more complex picture of well-being with all these interconnected layers.
And as the text suggests, the real aim isn't just treating diseases after they happen, but actively working to build and protect health in its fullest sense, for us as individuals and for our communities.
It's about creating the conditions for everyone to thrive.
So maybe a final thought for you to take away from this deep dive inspired by the source. If you really embrace this holistic view of health, what does that mean for how you understand your own well-being? And perhaps, does it change how you think about helping foster health around you, in your own circles or community? Something to chew on.
Thanks for joining us for this deep dive into health.
We'll catch you on the next one.